The next topic is I wanted to talk about genetic predisposition versus cause. This is a huge area where RMF departs from regular medical thinking because it makes me crazy every single time I go to research a condition to find out what's really going on in the body, what might be causing it. You know, you're looking for real causes, and instead you get causes are not known, but we have seen this trend that makes us think that it's genetically predisposed. Well, a genetic predisposition is not cause. It's not even worth mentioning, really, because okay, so yes, you see certain conditions happening more in certain breeds, and it's probably because of a weakness that was deliberately bred into the breed, and I'm going to talk about that. But it needn't manifest at all unless you have real causes. So the cause is where the power is. The cause, discovering causes, real causes, is where your power is. If you rescue a dog with floppy ears, you can't change the floppy ears. You can't change the shortened respiratory tract in a bulldog. You can't change the narrow hips on a German Shepherd. There's just so many examples of things that you can't do anything about. Now, as breeders, breeders can do something about it generally, but that's not going to happen. People are going to breed dogs. They fancy certain breeds, and I can't fault anybody for that because I fancy spaniels. But that's not going to change. So the thing that's going to change, the thing that we have power over, is we can figure out what the real underlying cause is and how not to burden that already genetically weakened process or feature of the body by subjecting it to these bigger problems, the cause, the burden. So I thought of an analogy or a metaphor that I thought would be really interesting for people to mull over as they're trying to kind of come to grips with this idea of genetic predisposition and how it needn't ever manifest as disease. And I'm sure that there are a million other metaphors that I could use. But the one that came to mind was a wooden staircase with some strong planks, some planks that are made from really strong, dense wood, and some planks that are going to be made from weaker planks of wood, like maybe the wood is knotty, maybe it's more porous, maybe it's less grainy. I don't know what might constitute a weaker slat or a weaker plank in the stairway. But imagine this stairway being walked on for years and years and years by obese people. Well, if it's walked on by obese people every day, those weaker planks are going to wear out, and eventually they're going to break through. But here's the analogy. What if that staircase is never walked on by obese people? It's going to last a lot longer. Those weak planks might never break through. So the burden is, and the unnatural part is the obese people. So the burden for us would be subjecting these already weakened, genetically weakened body parts to an unnatural burden. So, for example, like ears in dogs they're meant to be, the reason why they're upright is because they are meant to collect the sound wave and direct it into the funnel that is the ear. And what we've done instead with floppy-eared dogs, because we like little dogs that look like they have little pigtails, like little humans, because that's how we see dogs. Like, once again, I can't fault anybody for that because I like dogs with floppy ears. But there's a way around having that become a problem for us. But the problem with the dogs is instead of having that channeling effect, we have a muffling effect, which is just the opposite. So not only does does this changing of what a dog's ear looks like have a functional effect in the hearing, it also has, we can assume, some kind of functional effect on cleansing, because we do know that statistically, dogs with floppy ears have more problems with ear inflammation, and we don't know why. Because it's not the dirt that's sitting on the inner surface of the ear canal that's causing the problem. We know that it's what's coming through in the bloodstream and what's being eliminated through the ears that shouldn't be. But maybe what goes along with that is natural evaporation. Maybe that ear canal is supposed to stay um, there's supposed to be circulation of air, and that causes the cleansing to be more effective through there, and maybe that's why. I don't know. But what we can do differently is, instead of just reading on the website, you're going to go to a website and that talks about any website that talks about ear problems, and it's going to mention that dogs with floppy ears have more of a problem. Well, it doesn't have to be that way. And the important information is that you needn't burden the ears with the job of elimination. And the only reason why ears should be used as elimination is when there's too much elimination to be done by the primary organs. So what this whole area of genetic predisposition versus cause started me thinking in is the malpositioning of the stomach possibly being a factor in GDV, which is, euphemism, or I don't know what the word is. It's called bloat, colloquially. That's the word I was looking for. But GDV is what it is. That's what vets call it. It's gastric dilatation volvus, or volvulus or something like that. It's a very long word, so they call it GDV. Is where simple bloat, turns into the stomach turning over on itself. And there's lots of speculating about why deep-chested dogs, or more accurately, when the depth of the chest to the width of the chest ratio is greater than in normal dogs, why it happens, this problem of bloat or GDV happens more often in those dogs. And I have a theory about that, and it's that dogs, when food is sitting in the gut, not getting digested for whatever reason, in dogs with this malpositioned stomach, the stomach might be lower than it would be on a dog that's not so deep chested, is not able to push the food as far as it needs to in order to defeat gravity, with that reverse peristaltic action that the body needs to do in order to get food out. It's just a little too far to push it, because dogs will try to vomit when they have bloat. In these dogs that have that feature of the ratio that's different, it's just a little bit, the length part of the ratio is a little bit different than normal, than regular dogs. So that's, it's one possibility that the dog can't vomit. And what I've thought about would be an interesting thing to research would be to find out if these dogs with this ratio that's different have difficulty vomiting at all, if they vomit as readily as normal dogs. And I don't know how you would even do that kind of research or that kind of study, but It seems like there might be some kind of impairment of that emergency function if that's one of the factors in bloat. Now, I did look at, and I wanted to share my screen here a little bit, so hang on. Okay, so I'm going to share my screen here for a minute. Because I wanted to show you this article that I found on bloat. And it's by a vet named Glickman. I couldn't find there's a, oh no, it's not by a vet. It's by someone named Sharon Flaumer. But she quotes a vet named Dr. Glickman. Larry Glickman apparently conducted this study. But just to summarize what the article says, this guy, Dr. Glickman, did a study of 1,900 dogs, and he followed, I don't know how long he followed them, but he found that 105 of them, they were all large or giant breed dogs, and large was defined as 50 to 100 pounds, and giant was defined as over 100, as I recall. But 1,900 dogs were followed, large or giant dogs, and 105 of them developed bloat. And as I recall, only about a third of those died. But he found some interesting commonalities among the dogs. And body shape was one of them. So that ratio of chest depth to width. He found that fearfulness was a risk factor. Age was a risk factor. So as a dog gets older, the likelihood increases of developing bloat. He found that underweight dogs are more prone to bloat, which I thought was interesting. And I don't think it is necessarily the underweight condition of the dog that's causing the problem. I think underweight is a function of digestive inefficiency, and it's the digestive inefficiency that's causing the bloat. So that would be the root problem, not the underweight, because dogs who are properly fed and underweight and extremely efficient in their digestive abilities would not be at risk for bloat. So that's that veterinary bias and kind of ignorance showing up there. And he also found that, and people might realize this already, but that raising the food bowl is a risk factor. You do not want to do that. You do not want to feed from one of those raised platforms. If you have a dog that's, I don't think it's a problem unless you have a dog that's that is predisposed to bloat. And he found that I think he might be mistaking air in the stomach for gas. I don't think he knows whether this air that's in the stomach is swallowed air or gas that's produced by the dog's lack of ability to digest the food. So, he's saying that air is being swallowed. It may or may not be true. I don't know, but he says that that's possibly a risk factor. Large meals are definitely a risk factor. And he found absolutely no commonality among the foods. Now, apparently he's written another article about comparing the various kinds of foods, because there was so much variation in these, in what these owners were doing food-wise, that he couldn't, it makes for a very complicated analysis to try and find some common denominators. And I've also found that that bloat happens, no matter what dogs are fed, and it can even happen when dogs haven't been fed recently at all. So, although I've never seen that happen personally, in the cases of bloat that I've seen, it seems to always follow within a few hours of feeding. But the thing that I wanted to, in fact, he said, and I thought this was really interesting too. He said that 70% of bloat cases occur late at night, hours after eating. So that might speak to, and once again, we're kind of speculating here, but that might also speak to the idea that dogs are being fed late in the evening when they would not otherwise choose to eat if they were following their natural dictates. But anyway, I wanted to get to that, and that's a big chunk. 70% occurs late at night. So what that might say is that dogs are not supposed to be digesting food when they're sleeping at night. Dogs are not quite as diurnal. They have a little more nighttime activity programmed into them than we do. But still, they see better during the day, and they probably do most of their hunting during the day or at dusk. I don't know, if they do most of their hunting at dusk when the deer and elk are active, then it would be a natural thing for them to eat at night. So I don't know what to make of that. It's just a big chunk, 70%. But he goes through all the various risk factors here and how he sees these each as having a role to play in bloat. But the main thing that I wanted to talk about, he has this section called planning ahead, and I had never read anything like this about bloat, and it deserves a little bit of discussion here, I think, because pretty much everything else that we've seen here has been mentioned elsewhere. But this paragraph, these two paragraphs that he wrote here at the very end, are really interesting because he says bloat can occur at any time, not just after eating. And when it does, it can happen very swiftly. If it's not treated quickly, the dog will die because it can have a rapid onset. Owners may not have time to get their dog to a vet. When dogs are down and in shock, the only way to save them may be to perform emergency first aid. In this regard, the first thing to do is attempt to pass a stomach tube down into the dog's stomach to relieve the air. This is effective if the stomach has not already twisted. If it has twisted, however, the tube won't pass into the stomach. In that event, a large gauge needle called a trocar, which is much larger than one used for giving vaccines, should be inserted into the side of the huge distended abdomen to allow the air to escape. There is a hissing sound as the air is released. To be prepared, owners of high-risk dogs should have their vets train them to do these procedures in advance and provide them with the necessary equipment. Now, I'm thinking, I can't imagine that, and maybe it's because I haven't talked to a vet about this, but I can't imagine most vets being okay with this. Teaching an owner how to put a needle into their dog's abdomen. But the fact that it's emergency treatment and it's life-saving treatment and it's legitimate because a vet can't do this within 30 minutes of a dog showing signs of bloat, but an owner could. And so, vets might be afraid of the liability issue in training owners how to do this, but at the same time, it's absolutely legitimate. And he says in a note here, owners who fear they will injure their dog seriously or cause it to bleed to death by inserting the needle into its abdomen need not worry. A dog with a dilated abdomen will not bleed to death after the abdomen has been punctured with the needle. But even if an owner did do damage, the dog almost certainly would die anyway without emergency first aid treatment. So the owner has little choice. So I think this is something worth pursuing for the owners of these genetically predisposed dogs that are at high risk. So there's a lot here that we might glean. There's a lot that we might go too far with, like, never feeding past 4 p.m. or whatever, because of this problem of this bloat occurring so frequently late at night. Who knows? We might take it too far, but I guess it's better to be conservative when it comes to this kind of thing. When we don't know, when we don't know exactly what's going on and what cooperating with certain risk factors might accomplish as far as preventing this problem from happening.